I would like to call this meeting to order. Today is Tuesday, September the 2nd, 2014, 6 p.m. This is a special meeting. Our invocation today will be by Mrs. Turner.
Thank you, Leah. As we bow our heads, O Heavenly Father, we ask you to be with us. Lead us and guide us, O Lord, as we make decisions to be good stewards of what you have given to us. We ask these things in Jesus Christ's name we pray. Amen.
Thank you. We have an established quorum, Councilman Nieto, Councilman Guerrero, and Councilman Rodriguez. If everyone will please stand for the Pledge of Allegiance and the Texas Pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to you, Texas, one state, under God, one indivisible.
At this time, I'll entertain any citizens' comments. Not ready to go straight into our public hearing. I'm hereby open the public hearing. Time is 6:07. The City of Floresville is holding a public hearing in order to gather citizen input on the 2014-2015 proposed City of Floresville budget. At this time, we'll take any citizens' comments.
Mayor and City Council, if I may, we have put together a budget that we're probably 80% done in reference to that. Based on the last meeting, following the 4A, we're going to create the 4A budget. You accepted, I believe, the 4B budget. And what we have before you coming up on next Thursday is actually going to be the last department we need to cover, which is our water department and our sewer department, and of course, talk about the salaries, whatever we're going to do. We'll have that discussion on Thursday. So that's what we have in reference to that. As you go through, we put it together, coming out, working on putting a draft together. We're hoping to have a draft review sometime around the 9th of September, so that we can be ready to look at the final budget as we put together the numbers on the 11th. The last meeting that we had in reference to the fire department, we still have to do some shifting, and so that's what we're working on right now to get those together for you. To accept that agreement that you all discussed. Yes? Okay. To discuss that agreement that we discussed in that meeting, so we're going to put those things together.
Doesn't look feasible, Ms. Henrietta?
Yes, and we doing some research on those other line items that we can going forward, so it doesn't look feasible to be able to do that. We have put out an email. Our email was down last week, and our phones as well, but we did put out an email to the comptroller in reference to our hotel tax, asking those questions from that last meeting about what we can use and those kind of things in reference to that. Also, it's going to help, for example, we won't be doing any maintenance this year for the 4A, so those kind of things will not be coming under the general fund. It'll free up those funds to do what we do going forward. And historically, you have put the $25,000 in there. So you have a $25,000 to $30,000 for repairs, so we won't be putting that in there for the next couple of budgets anyway.
That's to the 4A. That's to what?
That's to the 4A, correct, the 4A Community Center, yes, sir.
Is that's all that it's required to operate on its own?
No, sir, that's in reference to the maintenance. Now, remember they received that lawsuit, so we're going to make all those repairs.
Okay.
So we won't have to be using dual funding to make repairs to the community center.
Okay.
And just remember for the salaries, it was somewhere between 1% on the low end, 4.5% on the high end. And I'm working on trying to find some information in reference to how we can talk about our base. And I'm having some trouble with our internet, so I'm having a hard time printing it out. But I do have some things from Tina and our recommendation on how we can talk about the base level.
On that last meeting, can we squeeze in the EMS? Every year they come to present to us. They're just like the fire department. They're emergency services for us. I know that we only have so much money for them, I still would like to hear from them.
I haven't reached out to them, but I will, Mayor.
Okay.
We talked about that late last in the week, and so our phones were definitely out. So we'll reach out to them and see if they can come to the meeting on Thursday. If not, we can invite them to the meeting on the 9th. Our goal is to have a draft for you to approve on the 11th to give us a wiggle room, but definitely by the end of the 25th to be able to have that. And I want to thank all of you for coming tonight so we can have our first public hearing. So this is on the budget portion of it. We're going to make some copies of you. I don't know if you brought it in reference to the tax rate, because that would be the next thing. So I'll make copies for you, no problem. So that we can have that moving forward. As I said, Connie's been working very hard to put the numbers together, to get the bottom line. We have to create a 4A budget. We have to create an municipal budget based on the letter that you all received today. And the fire department are 3 big things we're working on. Anybody have any comments on the budget before we go over that?
Okay, then at this time, we'll close this public hearing at 6:12. Okay. And I'm sorry she took my copy, so I cannot talk about it. Okay, then we're going to go on to our second public hearing. Opening it at 6:13. The City of Floresville is holding a public hearing in order to gather citizen input on a 2014-2015 proposed tax rate. At this time, I'll entertain any citizen comments. Okay, now we'll wait for you, Ms. Clinton.
And I don't think I have a lot to talk about because we already talked about it on the budget workshop. Almost the revenue stayed almost the same because we proposed the rollback rate, which is almost the same as last year. Okay, as you can see on the worksheet that you have in front of you, last year the taxable assessed value on the homes in Floresville was $274,806,405. The tax rate was 0.3234, doing a tax levy of $888,724, giving us a interest in debt and interest payments of $463,574, leaving us a maintenance and operations budget of $416,646. That was for last year, and the reason why I went over it so I can give you a comparison. On the rollback for this coming year, 2014-2015, the taxable assessed value is $115,114. Oh, that's a tongue tie. Sorry. Okay, and the tax rate for the rollback is 0.3252. That was an increase of 0.0018, very minimal. The tax levy, because of the increase on assessed value, is now $930,446. This increase is due to the increase on properties, not on the increase of the tax rate. The debt and interest payments that are going to be this year are $436,116, leaving a maintenance and operations budget at collection of 94% of $464,670. Do you have any questions?
That's a rollback rate, right?
Yeah, that is at the rollback. The highest interest is, tax rate is the effective tax rate. But if we go with that, even though it's 0.0068 increase on the rate, it will still can trigger a rollback election. So since the difference is not much, and I did the calculation on the revenue, and it's only $14,000 difference. So it's not even worth trying to. Now, if you want, we can increase it, try to do what Laura tried to do last year, increase it by 10 cents. So we can get out of the debt, but that didn't go last year, so I don't think it will go this year either. Because that's a big increase, at 10%. Or 10 cents for 100. And of course, your proposed rate is the rollback that we did. The current rate it will also be our rollback rate based on the sheet.
Mayor, if I may, City Council, Connie, if you can speak to the tax levy available, your fund would be a collectible rate of 94 to 98%?
Yes. Okay, the collection rate, right now, for last year, the collection rate was set at 98%, which was a little high. We're not gonna be able to meet it. 98% of the tax levy was $416,646. If anything, we're gonna get close to it, but we are not gonna meet it. This year, the appraisal office told us that 94% is a more realistic percentage of collection, so that's what I went for. I went for the 94%. If we go beyond that, which this year we're at 95%, but we're not at 98%. So if we calculate it at 94% and we go a little bit higher, and then that's good, because that means that we're not budgeting over the 94% collection. Do you have any?
Yes, you can speak to the check we received as a refund today.
That's a norm. The appraisal office charge the city for their services. The city currently doesn't have an appraiser, an assessor and collector certified person. That has to be certified by the state of Texas. Because we don't have that person, I cannot assess taxes. That has to only be done by the appraisal office. Because of their services, they charge us a fee. Because they calculate the tax rate, even though I also calculate it and we compare it. Okay, today for the 2013, we received a check of $2,000 back on 2013 fiscal year. So that's something that happens once they evaluate and they look at the fees assessed, and they realize that they overcharge us, and then we'll due for a refund.
And the last thing, as we're preparing our ordinances, the staff is recommending the proposed rate of 0.3252, which is also the rollback rate is what staff is recommending for adoption. And we can put that in the next, we have one more public hearing, but that's what we're proposing is the rollback rate.
Eventually, and I want to note this to you, is that eventually we will get back into the norm, which the rollback rate is higher than the effective tax rate. Well, right now is upside down, because in 2010, the debt was calculated higher than it was supposed to be. And I think it has to do with the restructuring of the debt, and all of that has an impact on the rate. So that's the reason why for the next years, we have to be adopting the rollback rate until somehow we turn it around. And that's what I'm working on. I'm trying to look and see how we can turn it around.
This fiscal year, we're working on a budget amount of how much?
It is the same amount as last year, and let me tell you exactly what that amount is. Okay. This year, we're working on 8,255,298. That's the proposed, the city manager's proposed budget. And last year was 8,140,486. So there's a difference of 100,000.
8,255,000 what?
299.
291?
And that 8,144,000.
No, it's 1,100,486. And I believe that the difference for these is because of the increase on the salaries for the collective bargaining. And also, he wanted 2 police cars, and we budget that we need to go back and correct. So the budget is gonna go down, but we need to, from there, move some money to the fire department so we can make up the 60,000, because right now we have it at 28. So I need to do some moving around.
My goal and objective was to stay as close to last year's budget. I didn't see a huge increase, and if we did see an increase, we wanted to be able to use that for our 90 days that we need to have on reserve.
Yeah.
As we spoke to earlier at one of our meetings when we had Victor Creel here, one of the things we want to be able to do to make ourselves creditworthy is to have the reserves. That's really important, to have our audit fund as soon as we possibly can. We reached out to our auditor already to make sure that we can start the audit process a little bit earlier. So hopefully the new year, I'm talking new calendar year, we can start this process, but we need as much time as we can to save up that 90 days. So we can, whatever's left over for this year, start the fund, and hopefully next year we can be able to have and start budgeting for those funds so we can make the payments in a quarterly manner. If we're not at the 90 days, which I believe is a million a month,
It's close to $1 million. It's not even $1 million.
So let's
Like
round it.
100,000.
yeah, so let's round it up to $1 million because I had it in my purse, right? So if we try to have the 90 days and we're trying to get $900,000, we're going to set it up. If we can't have it all at once, we're going to definitely put it as the money comes in to say, so we can set that up. If we do it by ordinance, then we can show our finance people that we are credit worthy. That's really important. It's going to help us save a lot of money in the long run if we are credit worthiness and we're able to raise our credit rating from the triple-E to the A- that we need.
Anything over the 94% that we receive in the taxes and the tax levy, where will that go?
To the fund balance.
It'll go into fund balance in our, for having the lack of a better term, into our 90-day reserve fund.
Yeah.
It's 90 days.
What we're following right now is the insolvency zero budget base. That's how they call it. And what that means is that you're not gonna spend any more of the money that you're collecting. So we are actually spending less than we're collecting. So by doing that and presenting our financials to the credit agency, they will see that. They will see that our revenues are a lot higher. That's the reason why you cannot calculate a collection at 98% when you know very well that that's not gonna happen. That will be putting ourselves on a bind.
But even at the 94% that the appraisal district gave, that is a very high rate of collection of 94%. So we're really happy with that rate, and so we're going to go with the appraisal rate of the 94% rather than 98%. So we'll be putting together, if you look at that recap page, we'll be putting that together again because some things have happened since we had our meetings. We'll be able to better, but it'll be close within $50,000 to $100,000 of what was budgeted last year. That's my goal.
Basically, anything over the 94% is about $10,000 for every percent. approximately?
Approximately, correct. Yeah, so we're hoping that we can put it together and do a recap. But again, I want to thank everybody for coming to make these wonderful public hearings. It's so important to give people an opportunity, and we have to give a 10-day notice in the paper to allow it to happen, to have people to come and to comment, as well as we have them comment at our sessions. But in order to have this budget, we need to have two. So one down, one step down, and one to go.
And our goal is for the next public hearing to have a complete draft of the budget for your review, so that way you can ask questions.
Thank you.
Okay, then at this time, we'll close the public hearing. It is 6:28. And we're going to go on to item 3, new business, consideration and action to approve the City of Floresville Health Benefit Plan. Jason and Mr.
I think it's the first time I've ever been here by myself.
These are
This is just a little bit different than what you had last week, not much.
We wanted to give you all an opportunity to review them, have a chance to contact Mr. Talley if you had any questions. Staff is trying to get into the purpose of not asking you to look at something for the first time and approve it. So these are the rates, he's gone over the rates, just so that he'll explain, not everything is changing, some things are staying the same, it's all that Mr. Talley go through, what's changing and what's staying the same.
Well, thank you for letting me come back and present this evening. Of course, I was here last Thursday and what you,
So you definitely,
Jason, did this change from what you gave us?
No, all I did on this front page, if you recall, last week, we just talked about some annual totals and what those totals were estimated to be and what the savings would be if we changed the United Healthcare plan. So tonight, I just put together some thoughts as to what I would recommend for the council. These plans renew October 1, 2014. If you recall, we discussed the fact that we started this process in July, went out to bid to Aetna, Blue Cross Blue Shield. Currently, your health plan is with Humana. And we did even bid some partially self-funded plans, but it ended up that United Healthcare was no doubt the person that came in with good quality quotes. They have good products and they have a big name brand. Well, name brand is important because when you do hire employees, one of the first things they ask is, well, what's your employee benefit package? The city of Floresville has a very nice benefit package. And, that name brand helps too when somebody comes in and they know that, oh, well, you've got United Healthcare. United Healthcare being one of the largest healthcare companies in the nation. So, we're coming tonight because what we like to try to do is once the council approves these benefits, and if you approve these benefits, is have the meetings with all the employees timely so that way when October 1 rolls around, we've done this in advance, they get their cards timely, those kind of things, okay? So the first part there is the medical, and my recommendation would be to approve those two plans that you see in the blue that was provided to you last Thursday evening, and I've actually attached a copy on the back. Now what you see there is you see the cost by each tier. You see a base plan, which is $436 and some change, and then you actually see a buy-up plan, which is $484.76. My recommendation is to keep two plans. The city pay the base 100% like you've been doing, and then if the employee wishes to purchase a lower out-of-pocket, they can do so. And so the recommendation would be to approve those particular plans that I've noted there on the front page. The other recommendation is to keep the existing health reimbursement arrangement. Right now, after an employee meets $500, then the city assists with the deductible cost up to $2,000. So you could have an employee that literally is on a 100% plan and have only $500 out of pocket for major surgery. This was implemented years ago because instead of trying to keep your deductible at 500, which would be huge premiums, you do this and assist when that employee just needs it versus paying a 500 deductible claim for everybody and you don't know if they even have the need for it. So last year, if you recall on the last sheet that I provided, that total cost out of pocket, and this is some round numbers, well, I'll tell you the exact number, was $8,874.91. That was as of last week. And so your savings, if we do go the United Healthcare route, amounts to the number you see there in the blue, which is $11,020.80. So in essence, what that does for you is that you can keep exactly the same budget amount that you have in your budget now, and that's wonderful considering that budget is tight. And my hope this year was to be able to provide you something that you could stay within your budget without having to budget a 25% increase. So that's a good thing to happen this year. You go back to the front page, then of course the city pays for basic life insurance. I've shown you the rate of 30 cents per thousand. That rate is less than your current Humana rate, so that's going to be your savings as well. And then the short-term disability, that rate is the 0.373 per $10, and that is actually lower than the current rate with Humana as well. So the things that the employer pays for is going to be less cost than the current plan. Then we have some supplemental plans. Supplemental life insurance, that allows the employees to actually purchase life insurance on the job. The neat thing about this, by changing to United Healthcare, we're going to get an open enrollment period, which every employee would be allowed the opportunity to purchase $100,000 guaranteed issue. To even purchase coverage on their spouse, guaranteed issue up to $25,000 and $10,000 on children. Well, the reason that's important is because we do have people that maybe decided not to buy it last time. This time it gives them that opportunity to buy it at no health questions, at least up to the 100. Sometimes that's the only life insurance a spouse can buy because they might have a health concern and they've been denied elsewhere. So that's a good thing. The dental and the vision, we had those with Dental Select, which were chosen last year. There's no rate increase on those two particular products. We haven't heard any complaints or dissatisfaction when we met with the employees and the staff here at City Hall. And then keeping the legal plan as is because there's no increases there. So those are my recommendations lined out there for your new plans moving forward 2014/2015. At this point in time, I'd ask if you have any particular questions on the proposals.
Are we currently paying the basic life and short-term disability?
Yes. And that amounts to, the basic life with Humana was like $2,845. The United Healthcare was $2,754. We're not saying that's a huge savings, but still, even the STD is going to follow those same kind of out of pockets. But it's still going to be less than what your current budget amounts are.
What's your thoughts, Henrietta, on offering the second option?
My thoughts is that we met with staff, and I think in reference to changing Humana to United Healthcare is a good switch. We wanted to have a name brand, I have to agree. We talked to Mr. Talley and didn't want to change a whole lot of other things in reference to that. The term life insurance, I think is great for people to have an opportunity to sign up again because some people don't pay attention to life insurance, their life changes and things such as that. This would give them an opportunity. We're going to spend the month of September letting everybody know where they are. The thing that staff didn't recognize is that you can actually carry your children on your benefits until they're age 26, regardless if they live at home or a full-time student. That is new. And so we want to let everybody know.
Well, that came in last year with health reform.
Yes, and so it's something that people are not necessarily, usually thinking if they're in college full-time and they can be on the, but they can carry them until they're 26. So we want everybody to take a look and take advantage of whatever they can take care of. And so we're recommending this. It is a savings. But if it goes up based on whatever we have in our pool, we need to keep it because we don't want people switching their healthcare, changing doctors or whatever. So, but we did also recognize that United has a lot of the same doctors that Humana has, so they probably can keep their same providers. As children with pediatricians or you're used to having this doctor, they should not have much trouble between out of network. The network should be complete.
United has a very strong network in the San Antonio Bay metro area, and we shouldn't have any real issues with network access.
Right. It is one, especially with our bargaining agreement, we really truly believe that this will be something that's comparable to Humana. We had United a few years ago.
It was really a long time ago. We've had Humana for several years now. Probably had Aetna for the longest stint, and it's really Humana and Aetna both have been the main two who've been contributors. So I was a little surprised when they stepped it up. And the other thing too that happened is that they really came in with rates higher than what you see. And of course, I don't always take that as the first deal. I went back to them and I said, hey, there's a possibility that if we did incorporate some of the other benefits, y'all need to work on those rates. And man, they knocked off a good percentage for us. So that's good.
So tonight for approving the plan, we're approving both options, option 1 and 2?
Yes, you're approving the basic plan and the buy-up plan to change from Humana to United Healthcare. Is what you're approving. Actually, you're approving the benefit package itself.
Yeah.
It's presented, because we have to renew with all the different companies. And so I think we normally do about September 1, since that was a holiday. As soon as we want to be able to give you an opportunity to do so that we can spend time with the staff going through signing up, however we want to sign up, because enrollment is only September, and after October, they're stuck with what they have.
The way we handle the enrollment is we announce it to everyone. They come in small groups into the council chambers, present what the costs are. They have a price sheet so they see what their costs are, ask questions, and then we'll come back usually the next week and do the enrollment. That way they have an opportunity to go talk to the spouse and whoever they might be talking to about the changes. So they really have ample time, and then they come back with all their stuff completed, or we assist them with the process.
So they
That
basically,
portion of the contribution is less this year than is less. So they're getting a comfortable plan, it's less for their contribution if they go to the program.
so they're basically getting, they have the option of getting both plans, or no, just one or the other.
One or the other.
The basic or the buy-up. I
Okay.
personally take the buy-up, but that's not. Is the
But from that, the employee rate, yeah, I was just.
They pay the difference, yes. So the city only pays for the base cost.
The 436.24, and then,
Right.
okay.
So they'll pay the
That's
difference
the
between the 44 and 436?
Yes.
Okay.
So the buy-up, the staff has to do that, but it's saving and they have more people buying up because it's almost the same. I can get, I'm paying for the basic now, I can do the buy-up plan, but it's definitely their choice to be able to do so. This is the sidebar, we have Aflac as well. There's no changes in rate for Aflac, so Aflac will be one of those offering again, but they pay for that totally themselves. But that would be also the sign they're going to be doing in the month of September.
Why isn't there an out-of-network?
Well, there's actually, that particular plan does not have an out-of-network. We chose that because when you look at health plans, about 98%, 99% of all your claims are in-network. Now, emergencies are covered as an in-network benefit, but a lot of your companies are going to that to try to get the savings down, so those particular two plans do not have the out-of-network. But United Healthcare is so strong in our region, they have a big sales office and service center in San Antonio, that I really don't see it being a problem, and I recommend that they go that route. Otherwise, what you'd be doing is you're going to be spending more, in healthcare costs. Now, in the meetings, of course, we'll communicate that very clearly to them so they understand that they need to be sure that they choose their provider in network. I will tell you from experience that the employees here are very good about that, because they get, if I do go elsewhere, it's going to cost me more money. So that's, I would concerned about that just because even if you have an out-of-network, let's just say that well, see what happens when you have an out-of-network benefit, your deductible's pretty much double. So you're gonna be using that out-of-network deductible anyway, paying those claims out of pocket. And many times, they don't even ever meet that deductible out-of-network, okay? So my experience has been, even with larger cases, 200 and above, you see very, very few claims out-of-network.
Yeah, and the unique thing about the out-of-network part is that if I'm out of town, I'm out of state, or, I'm not in Texas, it does happen on my record, I'm not in Texas, then if I get into an accident, I'm covered anyway, because I'm out of state.
It's an emergency.
If they're locally, so if it's an emergency, the policy will carry you out of network if you're out of state. So if you're in California or you go to Vegas, you're okay, because it doesn't matter if you're out of network or not, because you're out of state, you're covered. And so we're thinking the day-to-day, every day, you should be in network for your provider.
And the good thing is too, even out of state, similar to Blue Cross, their networks are so large, even across state lines, that you usually have access to providers in those areas.
Jason, out of curiosity, the local doctors, do they take United Healthcare?
Yes. Now, that's a blanket statement, yes, but the most popular doctors that I'm aware of do, okay? We do have some newer physicians that have come in with Allied and some others. I mean, I can't tell you that they're all on it, but most of your local docs that I see people filing claims with do take the claim.
Usually those newer doctors too, it takes them longer to get all their insurances set up. Eventually they'll end up carrying.
Right.
That's a pretty substantial savings that both the city as well as the employer, for their insurance.
Right.
Well, I think so.
Well, I do have to commend you, Talon, you did a lot of research, you brought us a lot more than what you have. We've been beating up on them, going back and forth, and got it to one that we feel that we can bring to you that's comparable. I have a personal stake in this as well, and that's a good point. I would recommend anything that I don't use, and since I can use it as well.
No other questions? May I have a motion?
I make a motion to approve the City of Floresville Health Benefit Plan.
May I get a second?
I'll second.
Okay, I have a motion by Councilman Nieto, second by Councilman Rodriguez. All in favor?
Aye.
All opposed? Motion carries 3-0.
Now, just a question, can this be entered into the minutes as well? Just so that
Yes.
you would have that, in case there's ever a question, they know exactly what the plan is.
Okay, with that, we adjourn this evening.
Okay, thank you so much. Y'all good evening.
Thank you, Mr. Talon.